Welcome back to the morning show here on Arise News. On Tuesday, the federal government, through the Nigeria Center for Disease Control, the NCDC, declared a Lassa fever outbreak in the country, following a total of 60 confirmed cases from 8 states. Yesterday, 4 people were confirmed dead in Plateau State from the epidemic. Now, Nigeria is one of several West African countries in which Lassa fever is endemic, with seasonal outbreaks occurring annually between January and April. Joining us now to speak on the Lassa fever outbreak and preventive measures is the Deputy Director, Prevention and Program Coordination at the NCDC, Dr. EMMANUEL Agoggo. Thank you for joining us on the program this morning. Now,
thank you for having me.
Again, an outbreak of Lassa fever, and already across 8 states. Now, what are the telltale signs to look out for?
So Lassa fever is an infection that is caused by a virus, the Lassa virus, and it presents very non-specifically, but just like almost like malaria. So with aches, pains, joint tiredness, abdominal pain, and so the symptoms at the very early stages are quite non-specific. Unfortunately, when it becomes more complicated, people can develop other complications like, kidney damage and bleeding. So bleeding from orifices, pregnant women can lose their babies through abortions. You can have extra heavy periods. Basically, because at that stage, the virus affects the way that your body system works, and therefore your blood doesn't clot so well, and therefore you have that bleeding. And therefore, it's a diagnosis that is made when you are sure that you've screened someone for malaria and for some of the other conditions that present that way, and you cannot make a diagnosis.
Well, the situation of a recurring Lassa fever outbreak was perhaps best described by the Minister of Health in 2015 as a national embarrassment. It has defied promises of health authorities to tackle it. Can you give us the latest update of this present outbreak? What are the numbers? What is the situation?
Okay, well, just to make a comment on what you just said, since 2015, I think there have been quite significant progress made in terms of our nation's ability to respond to Lassa fever. For instance, just last week, there was an international conference held here in Abuja where we had people, over 700 people from almost 20 countries across the world, from partners, the WHO, the CDC, from Germany, from Public Health England, all spending 2 days thinking about Lassa fever, what is happening not only in Nigeria but across West Africa. So it's an endemic condition, just like you said. We had colleagues from Guinea, from Sierra Leone, from Liberia, all sitting together and saying, what did we experience, what Nigeria experienced in 2018? What were the issues? And also trying to understand what is happening in those countries. The Lassa fever outbreak in 2018, like you said, was the largest ever recorded, and that has increased interest globally about this condition. It's a condition, like we said, that if you present quite late, unfortunately, which happens very often, the outcomes are not as good as we expect. This current outbreak that we are experiencing is much less so far as we've experienced compared to last year. However, because we're also better prepared, it's still been seen in those states that we are considering hotspot states. And those states are Edo, Ondo, and Ebonyi. This year, we've had at least 1 case in a few other states, one in the FCT, in Bauchi, and Nasarawa, and Taraba as well. So these are cases that have been identified, and measures are being put in place to find their contacts and to ensure that the communities that are at risk are aware that this scourge is on its way again.
As you've said, we're a long way away at this point, thankfully, from the statistics of the outbreak of 2018, where 23 states were affected. Right now, we're still at 8 states. What measures are you taking in concert, I imagine, with MDAs, ministries, departments, and agencies at the federal and state levels? What measures are you taking to contain this present outbreak? And we look at the issue of waste disposal, ineffective waste disposal. Can you tell the public what risks we run just by being in proximity to heaps of garbage?
Okay, so you've asked two questions there, and I'll take the first one. The approach that is being followed is one where we talk about a multi-sectoral approach and a One Health approach. Multi-sectoral just means that it's not just the public system, but with the private system, the NGOs, and international partners are all working together, and that has been the modus that we've been working in the last year and the successes that we got, and going forward, that is the approach. And then there's a One Health approach. The One Health approach means that with responding to conditions like Lassa fever, which are zoonotic diseases, and zoonotic diseases are diseases that affect both human beings and animals. There's a One Health approach which involves human health, that's the Ministry of Health, the NCDC, the state ministries of health, the animal health, so Ministry of Agriculture and Rural Development, and environmental health, which also brings in our colleagues from the environmental health sector. And so the idea now is to approach these diseases from a broader perspective, looking at all the contributions that each partner can make. And like I said, our partners, global international partners, are also been very involved in this approach, looking at and there's been this approach to set up EOCs. These are emergency operation centers at these hotspot states. When the outbreak was declared here in Abuja, the EOC was also activated here in Abuja, and therefore state ESCs were also activated in those hotspot states where we are seeing most of the cases. And in those EOCs, we have colleagues from the state government, as well as colleagues from Abuja, NCDC, and our partners, going to the states and working with them in those pillars. The pillars are around risk communication, case management, infection prevention and control, coordination of the whole response, and then laboratory services, just to ensure that any suspected case that you have can receive the treatment that they need, can have the diagnosis that they require to confirm whether or not they actually have the condition, so that we can get the best outcome for every person who is suspected to have Lassa fever. With regards to the environmental aspects, and in terms of that human-animal interface that is clearly the driver for the epidemic, for the previous outbreaks, and we suspect for this one. There are so many reasons that are blurring and narrowing that interface between human and animals. The rodent that has been implicated as the main vector for this disease is the multi-mammate rat. And at this time of the year, you find that there's a lot of bush burning, and so the rodents leave the wild and come into the households. During the conference last week, we heard about the impact of climate, so of delayed rains, as well as high temperatures, and also driving the rodents into our homes. And therefore, and then of course, not having clean environments, not deratting our households, not ensuring that we attract the rodents into the home by having refuse and waste food lying around, means that we will protect ourselves. And then ensuring that foodstuff is well covered and it's not exposed to the urine or the feces of these rodents.
Well, tell us, why are we seeing a population more prone to Lassa fever? And why are we seeing a more depressed immune system?
Okay, so there is no evidence to support that it's a depressed immune system. What the evidence shows from the outbreaks that happened last year, now there's a very interesting study that was presented at the conference in Science, which has been published in Science Journal, which was a metagenic analysis, so an advanced DNA assessment of samples from the cases that were identified. And where we were worried at the time that, is this a more virulent strain of Lassa fever? Or because sometimes you can have a virus become more virulent and therefore causing more effect. But actually, to the contrary, what that study found was that the majority of the cases that were found are still due to this closer animal-human interface. For one thing, there has been a lot more effort to try and suspect Lassa fever and identify cases, and that is one factor. The other factor, like I said, is also that from the studies that were shown during the conference, where idea of the impact of climate change, impact of a closer interface between the at-risk rodents and human beings. And then the other very important thing is late presentation. So the poor outcomes that we're seeing in patients is because a lot of times they're presenting late. A lot of patients who present may not, the suspicion that it might be Lassa fever is not as high as we want it. So we want healthcare workers who are seeing patients who have screened the patient for malaria, you've screened for typhoid fever, but you have a patient who's not responding. Contact, if you suspect it's Lassa fever, there are mechanisms now in place. You can contact your state epidemiologist, get a sample sent to the 4 labs that are available that have PCR technology to make the diagnosis in Abuja, in Lagos, in Irua, in Ebonyi State, as at the FETA, and in Owo. So these labs are all available to make the diagnosis and ensure that you receive the patients who come down with this illness receive the treatment that they need.
Well, just looking at your website and comparing this outbreak with that of 2018, as at this time in 2018, we had 22 confirmed cases, 3 deaths, as against the 60 confirmed cases we have now and about 16 deaths. What is responsible for this upsurge we're seeing? I mean, it's the same reporting week we are looking at on your website now, and these figures are way higher. And you talked about confirmation. We know Lassa fever, deadly hemorrhagic disease that it is, just like the Ebola virus, but can be treated, and diagnosis is very significant in saving a life. We have just 5 labs that you have mentioned across the country. Is this in itself not a problem?
So the 80% of the cases that occurred last year occurred in these hotspot states where we now have labs on ground where samples are collected and can be tested right away. In the rest of the country, and not every country has as many PCR laboratories, but at the moment, since there are no PCR facilities in all the states to make this diagnosis, there's a transport mechanism in place with which if a patient is suspected to have Lassa fever, a sample can be transported urgently, very fast and quickly from the state capital to any of these laboratories. And the state epidemiologists are aware of the mechanism for that. Again, yes, there appears to be more cases identified, but in anticipation of this, teams have been sent out to the states. Medication, the treatment medication has been prepositioned in all these hotspot states. Personal protective equipment that prevents healthcare workers to put themselves at risk have also been prepositioned in all these states. And training was undertaken last year and it's going to be scaled up this year to help clinicians to understand how to manage these cases better. Furthermore, a new guideline looking at our experience of better ways of treating the patients was developed and released from a national technical working group of experts from Nigeria and across the world who looked at what are the best ways of treating these patients, and that is being introduced this time as well.
Now, you've asked Nigerians not to panic, but what should Nigerians do? You've talked about the importance of early detection. What should we do in practical terms if people feel that they're coming down with symptoms? What's the next course of action?
So it links into the general best practice that we advise. You know, if you have they say if you're unwell, you take paracetamol for a couple of days, go see a doctor. And when you see the doctor, request for a test. If you don't self-medicate, so there's that self-medication. People take 1, 2, 3 courses of anti-malarial and also 2, 3 courses of antibiotics just because they say, oh, I think it's malaria. So if you feel unwell, you go to the hospital. If you have been in contact with anyone who you think may have had Lassa fever, you mention it to the doctor and you can have the test done. If in the last few days in your household you've had rats around your home, you've seen their feces, smelled their urine, you've had food exposed that you think might have been contaminated, that is an index of suspicion. And so it's so important that we think that when you treat malaria, and you are not responding, a clinician, we are saying to our medical colleagues, have a high index of suspicion and get the test done. And the medication is available to treat the patient. And once we start the treatment, the outcomes are clearly better. The risk of death, the risk of other complications is much less.
Well, healthcare workers are very important in this fight against the Lassa fever. We see them even becoming victims. Now, how empowered enough are they in terms of skill acquisition, in terms of training, and the diagnostic capabilities to fight Lassa fever?
So in terms of prevention, like with Lassa fever, there are two modes of transmission. So the more important one, which we've seen from evidence so far, is the zoonotic transmission, so from animal to human. However, there is also a possibility of human-to-human transmission, where the human being gets in touch with the, vomit or saliva, vomit or urine or feces of someone who is infected and and has a high viremia of Lassa fever. So one of the key things that has been pushed, that we've worked on with partners in the last couple of years, has been to improve the idea and practice of infection prevention and control. And this is something that means every healthcare worker should be able to have the necessary equipment, gloves, gowns, the capes, the caps, where they have to manage patients suspected with having Lassa fever. There's also been the whole move to work with the establishment of Lassa fever treatment centers. So specialized centers where we have clinicians who have that experience of managing these cases, with nurses who have the experience of how to put on don and doff gowns, don and doff the personal protective equipment, because there's a method to these things. There's also been a lot of work to pre-position, like I said, the necessary inputs to help individuals the healthcare workers who are in the forefront of the fight. Unfortunately, like you said, we did have quite a few healthcare workers affected, 45 last year with about 10 deaths. But during the conference last week, we had a very, harrowing but a very heartwarming experience of a colleague, Dr. David Isiele, who was affected last year, but who came through the experience and is still fired up to provide services. So we will need to respect and recognize and celebrate our colleagues who are bold and out there on the forefront of seeing patients and managing them.
Indeed, we owe them our gratitude, the health workers who do that. Let's talk about prevention. We know there's a national Lassa fever committee set up by the Minister of Health. One of its responsibility is to provide and produce a vaccine. How close are we to that?
So last week as well, I keep referring to last week, like I said, it was a conference, the first ever international Lassa fever conference. And one of our key partners in that conference was the organization called CEPI, the Coalition for Emergency Preparedness. The WHO was there. And so in the last year, there has been a push for a global move to develop innovations and vaccines against Lassa fever. Lassa fever before now has been one of the neglected among neglected diseases, and therefore prior to this time, there has not been enough focus on it. So at this conference, there was a conference track that was focused on vaccines and innovation, and we had colleagues from across the world, including some from Nigeria, who have been collaborating with partners in the US and the UK and in Germany, who are developing candidate vaccines. So candidate vaccines are looking at various aspects, pieces of the Lassa fever virus that can be used to stimulate the body's immune system to fight against the virus if you're exposed. So it's very early stages on the research, but there's a lot of work that is ongoing to find candidate vaccines that can be effective against Lassa fever. In the interim, prevention is better than cure, and that's why there's a push to work with our colleagues in the One Health approach to say, let us improve our sanitation in our homes, derat our homes, protect and cover our foodstuff and not leave them exposed, ensure that we're not drying grain and gari and so on the main roads for rodents to come through. Pardon me, ensure that also that the rooms that we live in are airy, and then avoiding bush burning that pushes rodents from the wild into our households.
Now, the tagline for last week's conference was 50 years of Lassa fever rising to the challenge. How would you say that you're rising to the challenge now to contain this outbreak? Are you positive in the prognosis, or should we be worried, essentially?
Well, I think Nigerians shouldn't be worried. Like I said, teams have been deployed to these hotspot states. All the states that we've historically had cases have had training. We have had support from partners as well as the government of Nigeria. There are fundings that's come from the government of Nigeria to the World Bank that we're using to ensure that all these that all the states have the necessary inputs that they require. There's been strong leadership from the top. The Minister of the Honorable Minister of Health and the Minister of States were at the conference. The minister was represented, and the Minister of State was available at the conference. And they've showed great commitment to the fight and the efforts that are being made against Lassa fever. Last year, the first ever National Council on Health was called an emergency meeting on Lassa fever during the outbreak. So there's it is very much on the front burner of the highest leadership of the health sector in Nigeria. And therefore, no stone is going to be left unturned to ensure that things are addressed. In terms of our partners and the NCDC as well, the establishment of the NCDC has given the NCDC the responsibility to coordinate these responses, and therefore teams have been sent to these states, and at the state level, NCDC has supported with funding from partners as well and from the government, the establishment of state EOCs. So at the state level, you also have emergency coordination centers, emergency operation centers, where these partners have talked about the human health, animal health, environmental health, risk communication pillars, the case management pillars. Everybody will be together at those state level, led by the state structures to respond to the cases at the state level. There's also the idea of what we call case identification and contact tracing. And that is a very key important aspect, that as we are identifying cases from certain communities, there's efforts to reach those communities, to engage with those communities, to identify what are the practices that are predisposing our brothers and our sisters in those communities to being infected with Lassa fever, as well as trying to develop messages that make sense to them. In going forward, there's also efforts to do social science research that also gives us some anthropological information and ethnographic information about what practices we should be addressing, apart from the core ideas of ensuring that we improve sanitation in our homes, and we seek help when we are unwell.
All right, you just mentioned case identification and contact tracing. What is the case fatality ratio for Lassa fever as we speak?
Okay, so this was a topic that was discussed quite extensively at the conference last week. Case fatality rates for patients who are unwell and end up in hospital is quite high. The case fatality rate is around about 25–26%, which is quite high. And in response to that, there has been a development of a national Lassa fever strategy that aims to reduce the fatality rate from the 25% we're seeing at the moment to less than 10%. And that will involve identifying cases early, making a diagnosis properly, and starting the treatment as quickly as possible. Those strategies will ensure that we catch cases early and we can treat them early as well. So the reason why those fatalities are quite high is that patients can develop a lot of complications. So for patients who are unwell and end up in hospital, they can develop kidney damage, a lot of bleeding, liver damage as well. And there's long-term sequelae sometimes of the infection, which include deafness. We had an experience from one top government official who came and shared his life story about being affected by Lassa fever during the conference as well.
Well, you have said you have not been able to identify the mode of transmission in this recent outbreak, but can you tell us if we are seeing urban cases? There's the notion that this was just restricted to the rural areas. Are we seeing urban transmission as well?
Well, the data so far, and every Friday we update the data. We'll be getting an update through the minister before the end of the week. We find that there have been cases in Abuja as well. So it's not, and then in Urua, which is a semi-urban center. So it's not primarily only in rural areas. We're finding suspected cases in urban and semi-urban areas as well. But primarily, for now, a lot of the cases have been fairly rural.